Shigella cases are spiking. They are exploding in Philadelphia. We had Portland. We had Multnomah County. Oh, had some record-setting Shigella going on. Now, Philadelphia. What do those two cities have in common? Well, they're both run by Democrats. Homelessness, yeah. Drug use, yeah. Yeah. Let's get into it. Here we go. Shigella cases spiking in Philadelphia. Oof, look at that. Look at that petri dish of just some goodness, right? Philadelphia health officials are tracking the rise of potentially antibiotic-resistant bacterial infection known as Shigella in Oregon, Multnomah County, and whatever other county that was. I can't remember what county it was. The Tri-County area. They have basically said, hey, the upside is if you contract it, we're probably going to get you a hotel room because we don't want it spread throughout all the rest of the tent communities. Because this thing is just so contagious. It's just boom, up it goes, right? All right. So why it matters that that Philadelphia is tracking this. The infection is easily spread and is most affecting vulnerable populations, those experiencing homelessness or opioid use disorder, drug addicts. So man-on-man sex, homelessness, because you don't have access to washing your hands or private parts before or after whatever kind of sex you're having. And then drug use. But the drug use in there, it's because you're a whole person, your body's kind of vulnerable to whatever. These are the bits and pieces that I'm getting. Shigella has been around for a long, long, long time. And there's numerous news stories from 2008. I came up with a story, 2012, 2015. They always seem to be in these Democrat-run cities that have a high homeless population. Yeah, I've got some sexual activities that aren't necessarily clean, apparently. Clean, a lot of ass-to-mouth contact. So there you go. I don't know how to say it any other way. Local cases began spiking in October with numbers more than doubling those in previous months. All right, that's not good, is it? I think I've even got here it is. To the rescue, I have got a chart. Here is your average Shigella cases in by month in Philadelphia. Look at October and look at November. Oh, you can't see it because I need to do this. How about that? There we go. October and November. I mean, we are way above the curve there. Yeah, these cases are spiking. They are rocketing upwards. So after an initial increase in Shigella cases in October, cases have continued to increase. We're on the rise in November and December. What will January and the beginning of 2024 bring? Who knows? I don't know. Another strain of some other medieval disease? It's crazy, right? It's like Shigella. Huh. Okay. Yeah. Who would have known that, the circumstances that we've allowed to have happen in our homeless communities, and by I mean Seattle's just as guilty. One of the let's keep going here, but that was what I wanted you to see from that chart. So they continue to rise in November and December. We saw that. The infection can be spread easily from person to person by ingesting small amounts of fecal matter, like via contaminated food and water. A food truck got infected in Portland during sex or changing diapers, per the CDC. So oftentimes you'll see this disease with little kids because you got the whole diaper thing. And then in nursing homes is another prime example because, oh man, I do not want to go out in a nursing home, right? I don't know about you, but totally necessary to have these facilities. But man, that is not the way I want to go out. Spent a lot of time with my grandma and multiple of them towards the end of her life. And it's just a tough go. But, what are your options when you're at a certain point in life, right? Symptoms typically start within 2 days of contracting. It's really contagious. That's the bottom line, right? Okay. And then this, here we go. And the CDC warned earlier last year about an increase in antibiotic-resistant Shigella, which has been turning up in other cities, including Seattle. What? My hometown of Seattle is involved? I can't believe that. Let's say, Multnomah County. Well, author of the article, Seattle's not in Multnomah County, it's in King County. So that really wasn't Seattle. So if you didn't hit that hyperlink and you're running around at your fancy hoity-toity cocktail parties telling people Shigella is exploding in Seattle as well, you would be incorrect. But the reason I'm doing this podcast, we got Portland, we got Philadelphia coming soon to a neighborhood near you. Tents, drug addicts, some sexual activity that isn't as clean as it might necessarily be. Not promote spread of Shigella. So this article just basically kind of goes back and says, wash your hands a lot and wash your, whatever, whenever, you do whatever with your whatever. So there's that, right? Okay. All right. But getting back to Philadelphia here. All right. We've got an increase in Shigella cases in Philadelphia. We got an advisory on December 11th. We got an advisory. Increase in Shigella cases in Philadelphia. We've got an advisory on November 8th. We've got an advisory. We've got one back in March. Increase in extensively drug-resistant shigellosis. Shigellosis, is that right? I think that's right. United States. So these drugs are these diseases, whatever they are, contagion, whatever. They are working their way towards being resistant to drugs. Yeah, who would have thought? Who would have thought? Right? Just kind of crazy. So here's the surveillance. Here's what they're looking at in Philadelphia. An increase in Shigella cases has been observed in Philadelphia over the last month. Cases have been reported among people experiencing homelessness and opioid use disorder. Is it really a disorder? I mean, you're addicted to drugs. Is that a disorder? Okay. Shigellosis is a reportable condition in Philadelphia. Providers who use culture-independent diagnostic tests, whatever, instead of culture for diagnosis should request reflex culture. Okay, don't care about that because I don't understand it. Cases in Philadelphia have increased in the last month. There have been 21 cases identified among adults, 4 cases identified among children since October 1st. Investigations are ongoing. However, preliminary investigations suggest that some individuals test positive are experiencing homelessness or opioid use disorder, when in fact, it has been proven that most of this is from men-on-men sex, and then men-on-men sex in the tents, period. The drug use, okay, little bit of that action going on there, but when you're doing drugs, you're not necessarily having that fecal matter to the oral, to the mouth, necessarily going on. So I think you throw that out there because you've got a lot of, tent activity already. And like I say, when the tent is a-rocking, don't bother knocking because you could have some Shigella going on. You just don't know. Now, this is one of those things where we've allowed this to take place by allowing people to just live in these communities willy-nilly with all the shenanigans that go along with the tent communities. Is these aren't people necessarily just down on their luck looking for a place to live. They're doing all kinds of other lifestyle. And this is one of those indicators. All right. Well, yeah. To top it off, we've got a little Shigella going on. Got some Shigella going on. Yeah. Wash those hands, right? Wash those hands. I mean, I feel terrible for these folks from the standpoint of they don't have the access to washing your hands like the rest of us do. But it's kind of one of those things where oftentimes they are choosing this lifestyle because they're out there doing the drugs, they're stealing the stuff, they're selling the stuff, they're selling their own bodies, whatever. And I think that's where a lot of this happens, is sex is used as a commodity. And there is an incredible amount of sex going on in the homeless populations that nobody wants to talk about. And there's a lot of, sex where it's one-sided. People are taking advantage of others. That you hear about all the time. But it's always kind of on this down low. So is this shocking? No, not at all. It's not. It's just not. And that's why you can't allow people to just live wherever the F they want. Oh, yeah, just post up there in the park. It's fine. Right next to the drinking faucet. It's good. It's all good. We'll just bring you some food. Yeah. Here's your tent. Here's your blanket. Here's everything else. This is one more of those storylines of why you can't just let people live wherever and not expect there to be some repercussions. This is one of those repercussions. Huh. Yeah, imagine that. You got a cleanliness factor in there, and things are kind of going sideways. And then you've got these health experts saying, wash your hands, wash the rest of your bodies, make sure you're clean, because that's how you prevent the oral fecal matter connection. Otherwise, you don't have it typically. And you've got it in some of those other instances, but that is not what we're talking about here. And both Philadelphia and Portland have come right out and said, yeah, it's kind of on the down low. You notice there's no real coverage in Philadelphia, because with Philadelphia, they've got so many other issues to work on that a little case of Shigella is just like any other day that ends in Y, right? It's just not. This is not newsworthy. But I'm covering it because we got it in Portland, Philadelphia. What do you think next? What do you think next? San Fran? Do we have an explosion in San Fran? Probably. I mean, why wouldn't we, is the question, right? So is this something that's just going to ramp up? It's ramping up in Philly in October and November. I mean, those cases just whoop to the moon. Who knows? Who knows? Maybe there'll be some big health alert awareness situations. Everybody will start washing their hands 14 times a day like we did during the coronavirus, right? Remember that? Wash your hands. Wash your hands. Wear your mask. Wash your hands. Wear your mask. Wash your hands. Oh, that was annoying. I'm all for clean hands because I've got contacts and, putting things in your eyes that you touch. You want to have clean hands because otherwise your eyes get infected, and that's not good. My eyes are already bad. So I understand. Yeah, you got to wash those hands. But the situations we've got going on here are clearly avoidable. But because of leadership roles, just live wherever, do whatever. It's all good. It's all fine. Oh, we got an increase in Shigella? What's that? That's the comment I get most, right? What's Shigella? Never heard of it. Yeah, just think, fecal matter to mouth, and you get infected and you get explosive diarrhea. It's not good. Let's just say it's not good. You don't want to get it. But it seems to be clustered towards these groups of humanity. Haven't ever heard of it. Well, yeah, you have. Shigella, your new best friend? No. Avoid it at all costs. But you know what? You're washing your hands and, you're clean otherwise, clean interactions with other people. Should be good. Thanks so much for supporting. I'll catch up with you in the next one. Bye for now.